Hey everybody, welcome to Health Hackers episode 16. I'm Gemma Evans and this is my series devoted to getting inside the minds of some of the most pioneering figures in health and wellness. My guest today is Dr. Steven Lin, functional dentist and author of The Dental Diet. Over the next 30 minutes, we're going to be discussing how you can achieve the healthiest, strongest and best looking teeth, gums and jaw for you and your children, according to Dr. Steven, and some of it might surprise you. Steven, hello.
Hi, Gemma. So great to be talking on the other side of the world.
Yeah, all the way in Australia and I'm in London. Steven, firstly, I love it that your Twitter bio describes you as an interior designer for mouths. What a brilliant job description to have. But you're also known as a functional dentist. How would you explain what the functional bit means?
Yeah, so somewhere early on in my career, I began to think about, why dental diseases happen. And, unfortunately, it's something that the healthcare profession, we do get a little bit stuck in this idea of treating disease instead of understanding why they happen in the first place. And dental diseases really are, for the most part, chronic, where 90% of them are preventable. And that means that the processes are happening for a very long time. And so functional dentistry is about understanding those processes long before they become diseases and preventing them and trying to reverse the flow-on effect that can happen from when we see things happen in the mouth and how that relates to the rest of the body as well.
Now, you talk a lot about the effect of lifestyle and evolutionary factors on our teeth that I've never heard any other dentist talk about. What was it that led you down this path rather than the more kind of conventional dentistry one?
Yeah, it's really interesting because our jaws and teeth hold, most of the data we have on our human ancestors. What we find in the archaeological records really are that, jaws and teeth survive the longest and that's what we dig up and that's what we study. We basically give our ancestors a dental exam. And so what I was really surprised to find was that when you look at anthropology studies and the history of our teeth is that dental diseases don't occur full stop. That's so tooth decay,
really?
gum disease, yeah, they don't happen. And that was exactly my reaction, Gemma. Because I got a hunch about this from a guy named Weston A. Price who did a worldwide study looking at teeth in 14 cultures all around the world in the 1930s, and he used the anthropological record in each place to kind of frame the context of how the modern diet changes teeth. And so, but when you look at all the studies that have happened since, and a guy named Robert Corricini has performed hundreds of studies in different contexts on people's teeth and their jaws, you don't find dental disease. It's tooth decay, gum disease. But the big one that surprised me was crooked teeth. So why we need braces today, that doesn't happen. And that's actually wisdom teeth impaction included. So for the most part of human history, humans have grown 32 teeth into their mouth without any need for braces or wisdom tooth surgery. And that was a real kind of awakening moment for myself, where I realized that what we see in the dental surgery today is vastly different from what our human ancestors and biology really is designed to be.
That is fascinating, and it's been compelling reading your book, The Dental Diet, learning about your focus on the effects of diet, nutrition, and breathing correctly. That was another thing, in order to have great jaws and teeth. Would you explain to us what it is that you can tell about a person's health just from looking at their teeth when they come and see you at the clinic?
Yeah, so teeth are probably one of the most critical things that we judge people by when we identify people. Faces really are the most powerful human trait you can have. If you think of families or good friends, you'll know their face, and it's actually etched into your mind. And we know this by studies that show that babies actually identify with more symmetrical faces, and they'll actually be more attracted to those people. And we find symmetry more attractive. That's why Hollywood stars have lovely square jaws and cheekbones, and teeth really are the foundations of that. So they're set into the upper and lower jaws. And so when we have a nice straight smile, it echoes this idea of symmetry in health. And so when you're looking at someone's teeth, you're really giving them a biological, exam on, their genetic fitness and their evolutionary, kind of history as to their health. And the real thing that really kind of sprung out to me, that's something I didn't learn in dental school, is that a straight smile and a wide jaw not only equates to a nice, nice teeth, but it also equates to a wide airway. And so something that you alluded to just before, the breathing, is that when you have a straight smile, and when you look into the anthropological studies, we see that the history of our airway has gotten much smaller. And that's when kids have crooked teeth, the result at the top of their airways, that the nasal sinuses are actually cramped as well. And this is a big problem happening in society. Probably one of the biggest health problems on the planet, Jenna, that our children aren't developing their smiles properly, and subsequently their airways aren't developing as a result.
So you talk a lot about this in the book, and there's a chapter called "It's Not Genetic: How Crooked Teeth Are Caused by Poor Nutrition." So if this is all down to poor nutrition, does that mean that by what we're eating, we can prevent getting wonky teeth or crooked teeth? Presumably what we feed our children can dictate whether or not they end up wearing braces. Is that your view?
Yeah, absolutely. So what we've found is that if you look at the anthropological studies, that when we see malocclusion, or crooked teeth is what we call it, when that pops up is when we start to eat the modern diet. And so what we can, and I think what we really need to do, is start to frame and understand how jaw development is influenced by environmental input. And that chapter that you're talking about deals with epigenetics. And this is the whole idea that our DNA code is much less set than what we have previously thought. We're not dealt these fate cards that our genes, when we're born. Our environment plays a big part. And this is really important with the jaw. And so one thing we found with, when you look at the historical perspective, is that when we take out the physical act of chewing, so using the jaw in a musculoskeletal way, then the bones don't develop, and the teeth are then more susceptible to be cramped and crooked. And so that's one factor that our jaws and teeth teach us about nutrition, is that chewing is a factor that we need to do. And one other arm of evidence in this is breastfeeding. And so when a newborn is born, it uses its tongue to push a mother's nipple up to its palate. And that actually expands the palate out because it's soft like wax. And that physical force actually helps to grow that palate out, and helps the child to create a nasal posture where it will breathe through the nose and have a nice wide face. So that all starts off, and that goes right throughout life. All of these epigenetic messages feed into our jaws and teeth, and our dental arch is the result in the end.
So is that what we want? We want to aim for a wide jaw. Is that a healthy, good jaw? Is that what one looks like?
Absolutely. So one way to judge it, Gemma, is if you look into the mirror and look at the palate. And so
the roof of the mouth.
The roof of the mouth, yeah, exactly. So if you look into the mirror and at the roof of the mouth, what we should see is a nice wide U-shaped palate. Now, what we see in children today is you'll see a high, very V-shaped palate, and it'll be very, you'll barely be able to touch it with a finger. And what that indicates is that the maxilla bone, which is the upper jawbone here, is thin and cramped in a way, and that will result in an upper smile that's crooked. But as we said before, it also results in nasal sinuses that are crooked as well. So those kids can't breathe through their nose, and then that leads to unfortunately further deformation of the jaw, where we don't get this forward growth. We get this long face and crooked teeth as a result.
So do you think that crooked teeth, breathing difficulties later on, are all caused by an underdeveloped jaw from childhood, and that is caused by modern living, processed food that we're not chewing enough? Is that what you mean?
The chewing is one factor. So the body is taking in many different messages to grow. So it's basically using all the resources that we give it. And chewing and physical force with breastfeeding and hearty fiber and gelatinous foods is one factor. Now, and the other factor that I think we really miss and that I really try to go into in my book are the fat soluble vitamins. And this is vitamin D, vitamin A, and another vitamin that we don't hear about very much, vitamin K2. And what these nutrients do is they actually direct calcium in the body. And calcium is crucial for building bones and for strong teeth as well. And so without enough vitamin D, we don't absorb calcium. By definition, we only absorb 15% of the calcium in our diet. So it basically falls out of us. But then what we really have missed and what the research, we really have to pin a lot of research from a lot of different areas together here, is that vitamin K2 works with vitamin D to distribute calcium into the bones and teeth, and that's out of our soft tissues. And so without these fat-soluble nutrients, our body doesn't have the raw materials to grow. And we know what happens, for instance, with vitamin D deficiency in kids with rickets. We have leg bones that don't support weight, and they have low bone density. This is the same thing we're seeing in our faces, is that we get this functional adaptation to bones that haven't grown enough because we're not giving them the right fuel.
So what would be the vitamin-rich foods that you would feed your children to help them develop great jaws and beautiful smiles?
So the foods that are rich in these fat-soluble nutrients are ones that we've actually stripped out of the diet in the last 30 to 40 years with the idea that low fat and certain animal products cause heart disease. And this kind of links into the whole cholesterol and diet heart hypothesis. But the foods that really are rich in these nutrients are their animal products. And the reason for that is that vitamin D, for instance, in its active form that our body needs, comes from animal products. That's vitamin D3. And so you only get that from foods like organ meats, egg yolks, grass-raised dairy, cheeses, these sort of foods. And these are the foods that we've demonized somewhat. And the same with vitamin A and vitamin K2. So vitamin K2 is actually converted from vitamin K1, which is what we get from green vegetables, spinaches. That green color is the vitamin K1. Now that's converted into vitamin K2 in animal form. So egg yolks, organ meats, things like Japanese natto actually has a rich form of vitamin K2, which is a bacterial form. And then the last is vitamin A from which we convert in its most active form, retinol. And you would probably recognize vitamin A from carrots and things like colored vegetables. But the active form of vitamin A comes from the animal form. So these fat-soluble vitamins require fat, and that includes saturated fat, to be absorbed into the body and assimilated in the body as such. And they direct hormones and they guide bone growth and the development of our teeth. And we've really taken these out of our diets. And if you look at ancestral cultures, they really did treasure these foods to make sure they got enough of these nutrients, especially in people that were expecting to be procreating, so having children. So they would eat diets rich in fat-soluble nutrients for 12 to 6 months before conceiving, and then right throughout pregnancy, and then children would have these diets rich in this. So it's something that we've somewhat lost. And if you don't think about it in the modern day, I guarantee that most people, you don't get enough vitamin D. If you just go and measure your levels, a lot of us are operating at biological levels that are far lower than what we need.
Do you think that the whole low-fat thinking for the last couple of decades has actually harmed our teeth then? Because we will have been missing out on a lot of those essential nutrients that are sometimes found in fatty cuts of meat or real butter.
Yeah, it absolutely has. And real butter is a great example because, for a long time we replaced, real butter with margarine. And we know margarine is devoid of these fat-soluble nutrients. And the vegetable oils, refined seed oils that we have, that we've, thought were healthier, really are devoid of these nutrients completely. So There's two prongs to, I think, the low-fat diet that has been harmful. And one is that we've replaced fat with sugar and simple carbohydrates. And that, for one, it drives tooth decay. And so that's, why we see, such high rates of tooth decay, both in the UK, Australia, and US, because we are consuming so much simple carbohydrates. But then the other side of it is that we've stripped out these fat soluble nutrients. And so I think it really is two prongs, and we've really seen that, the result of that. The low fat movement doesn't solve, on one end, heart disease and obesity. We've become more overweight and we have become type 2 diabetics. But then on the other side, our teeth have become worse. So kids today, if you think about the generations, 30 to 40 years ago, how many kids got braces? Today, if you walk into a schoolyard, you probably see, 7 out of 10 kids with orthodontic work. And that's because our jaws aren't developing. And so I think we've missed the message there, in our mouth of, what we really should be eating. And unfortunately, we've done a little bit of a harm with the low fat movement.
So you think that the reason we've all got braces, I have braces too, is to do with the fact that we're just not eating enough real good food like our ancestors ate?
Absolutely. And if you look at, for instance, the way our ancestors looked at that, they treasured these kind of foods. And some of the things they would observe is that if couples, for instance, would, if they ate diets rich in these foods, they would have babies with nice round heads. And that's as simple as it was. This baby's got a nice round head. That shows good craniofacial development with nice stable airways, upright head posture, nasal breathing, tongue to the roof of the mouth, which is going to direct that jaw growth. And then if they continue that diet throughout their childhood, then they're going to have straight teeth. And that's why people for, millennia, they didn't have wisdom teeth impactions. They didn't need braces because they ate the right foods.
This is so fascinating to me because I had a lot going on with my teeth as a kid. And maybe you could shed light on it because although I should say that now I'm very happy with my teeth and my dentist is thankfully pleased. But when I was younger and my adult teeth started to come through, two of them never appeared. They just never grew. I think they're called the lateral incisors right next to the two front teeth. And no dentist was ever able to tell me or my parents, as far as I'm aware, why they didn't grow. But it meant that I had this big gap between my two front teeth because there was all this extra room. And then to make matters worse, I sucked my thumb as a child. So then I had buck teeth with a gap. And eventually I had corrective braces, which were pretty painful. But even before that, I had like this temporary wire frame inside my mouth to bring the alignment back into position, which meant I couldn't speak during the day while I was wearing it. And then years later, you mentioned wisdom teeth. I had all 4 wisdom teeth removed. They were impacted. Now, from your functional dentistry point of view, was that all caused by me having an underdeveloped jaw?
So what, the tooth...
I can take it if it's a yes.
Look, there are genetic factors that do predispose certain people to missing certain teeth. And you do have a very lovely smile. And modern orthodontics, it has great tools now to correct. And that's the beauty of modern dentistry as well. We should definitely say that we have excellent tools to correct things and deal with acute situations. But we really understanding why that happened. And so what the studies show is that if there is a restriction on space in the dental arch, so in the jaw, so what happens is the tooth buds have to pop up in the jaw as a child is developing. If there is a restriction on space, there is pressure on that tooth bud to appear. And so in certain people, if there's enough pressure, that tooth bud will never appear. So that's one theory as to why that some teeth won't appear. And we see it a lot now. It's, for instance, it's close to 20 to 25% of people just don't get, I didn't have lower wisdom teeth. And it's likely because the lower back end of my jaw, we should really have another, 15 to 20% of jawbone here growing. And when that, we don't have that space, the tooth bud doesn't have the messages to form. So that's one pressure. So if it's a run-on effect in development, the body just kind of says, well, there's not enough space, and we keep going basically.
Well, thank you. So do you think it is that I just have an underdeveloped jaw then? And was it my early years poor nutrition? I thought I had quite good nutrition and I was breastfed, but maybe it was a genetic factor too.
Well, it's genetic and epigenetic. So your mother's, for instance, levels of vitamin D. So in the UK, obviously
Not much sunshine. Yeah.
yeah, very, very little, besides the last few weeks, there's very little sunshine. And so, for instance, vitamin D levels in breast milk will be passed to a child. So what I'm seeing a lot in the practice today is that kids that, potentially are, deficient in these nutrients, even when they are breastfed. And we actually, I think we're a long way where we should be in terms of the actual levels that we should have. So we probably think today that, the amount of vitamin D, for instance, there's studies that show that we're a long way below where we think actually what our body needs. And so the other factor is that there's some studies in Pennsylvania happening where the newborn jaws are being shown to be underdeveloped compared to what generations before. So actually kids were born with more forward set jaws than they are today. And if you look at newborns today, they do have the jaws that are very set back and the chin that really no chin in a way. And we've kind of framed this as normal, but if you look at the anthropological studies, humans, they had nice straight chin in line with the rest of the face. And that's been put down to breathing. So during pregnancy, sleep apnea is a big problem. So when you have a small jaw, you potentially deprive the fetus of oxygen because when you sleep, we have an increased rate of snoring. And so
and that can make the baby have a setback lower jaw if you're not getting enough oxygen as the pregnant mother.
Yeah, so it's likely that's what these studies are looking into. Now, I mean, they're not published yet, but we know that, for instance, low oxygen environments. So if it has an effect on the fetus. So it'll be a smaller fetus, and they'll have epigenetic play-ons throughout their life. So and we know that sleep apnea is a big issue. And so what it's kind of saying is that small jaws breed small jaws. So we're slowly going down a line where we were just so far anthropologically where we're designed to be.
What can we do about that? I've actually got a couple of viewer questions. One from Rich: how can we change the shape of our jaw if we're unhappy with it now as an adult when we don't want to wear braces?
So this is where functional dentistry really comes in. So you can expand the palate. So the palate is basically the centerpiece of the face. And in the UK, actually, they can look up what's Mike and John New, who run a type of orthodontics called orthotropics, and they develop the face. And so it's mainly focused on kids, but the principles are if you expand the bone, and you can expand the bone in adults as well, just by sending messages via an orthodontic device, you can actually change the shape of the face of an adult. And
really, without braces, it's a device that's sort of in and out temporary, is it?
Well, so yeah, you can expand the palate, so you can wear it at night, and it basically uses a little screw to put a force and what it does is it puts pressure on stem cells to form, and we can expand the adult arch. It's a lot less than what we can do in kids, but it is possible. And in certain people who have, for instance, obstructive sleep apnea and difficulty breathing through the nose, there is some very good outcomes where we see we can potentially reverse pretty serious sleep disorders just by helping someone to breathe through their nose, by getting them more nasal space. Because when you expand the palate, they get more nasal space by definition.
And you've got breathing exercises in your book as well, if anyone wants to see how to help expand their breathing. I've got another viewer question from Eve. Can you ask Dr. Lin if extreme austerity during world wars could have altered DNA in people so that their children would reap the results of a poor and sparse diet? Can this be corrected several generations later?
Well, they have studies of this from the Dutch hunger winter. I mean, that was published in 2007, that, when you have there was starvation in the Netherlands, and they showed that it does have a generational effect. The great thing about epigenetics is, yes, we can reverse it. But so what, there was actually a cat study called Pottinger's Cats, where he took cats off their native diet, and he showed that it took 4 generations for the cats to die out on a processed diet. And so 4 generations to die out. But what he tried was that in that 3rd generation, he put them back onto their raw meat diet, and it took 4 generations to heal. So 3 generations of damage took 4 generations to heal back to what the original cat's health was. So it shows that our genes take a bit of healing time, but it's possible. And so, but I really think the message is there that we need to start now, because I think if you look at children today and the issues they're having, we've moved a long way from what we're designed to be.
So your best advice with the diet and nutrition now, and how we can reverse the damage, what would that be?
So foods focusing rich on fat-soluble vitamins. So well-sourced, everyone has to, and so eating organ meats, and everyone's a little bit squeamish about that, but we need to get back to foods that are rich in fat-soluble nutrients. Egg yolks, no more egg white omelets. Butter, throw the margarine out, replace it with butter. Full-fat dairy, no more low-fat dairy, because it just doesn't make sense. And so these foods have fat-soluble nutrients, and they're the really nutrient-dense superfoods that our body needs. And then on top of that, we need to remove the foods that are causing damage, and that's sugar, refined flour, and the refined vegetable oils. If you remove those out and nourish the body, then I think we're giving it the tools to heal. And, we see really profound, the mouth can be, one of the first places you see benefits of this.
And correcting our breathing so that we're getting proper oxygen to our brains and any potential baby growing inside us, so that they have developed jaw.
That's a great point. Exactly. So oxygen is the #1 nutrient. I didn't mention that. But exactly. So nasal breathing. So 8 hours of nasal breathing at night. That is probably the most fundamental way that you can nourish your body. And if you don't feel like you breathe through your nose through the night, if you wake up with a dry mouth, or you snore, or you grind your teeth, that's a sign that you're not breathing correctly. And you should certainly look at, if you do daytime breathing exercises, yoga, diaphragmatic deep nasal breathing, it can train you to breathe through the nose comfortably throughout the night.
So just train yourself to get used to breathing through the nose rather than the mouth. Is that a good thing?
Absolutely.
Yeah. Is it true that you don't use toothpaste? And is that because you've tailored your diet so perfectly, you don't need the extra cleaning agent?
Well, the thing about toothpaste is that we've only used toothpaste for a few decades. It really is a bit of a marketing tool. I do use toothpaste. I don't use supermarket toothpaste, and the reason is that a lot of toothpaste is actually based around being antibacterial, and one aspect of dental disease is that we've really focused on killing harmful bacteria. But the human microbiome, we now know that we live alongside trillions of beneficial probiotic bacteria, and that includes the mouth. So we have bacteria in the mouth that protect us against tooth decay and gum disease. And when we kill these bacteria, we're actually sending a much less biologically diverse population to our gut. And so there was a study that came out last year that showed that people that use alcoholic mouthwash every day increase their risk of type 2 diabetes, pre-diabetes. And so we know that the gut microbiome profile of people with type 2 diabetes is less diverse. So that's showing us that when we lose diversity in the mouth, we can translate that to the gut, and that whole process can just translate through.
Yeah, there's a lot about the gut microbiome in your book, which is really interesting, because I've had guests on Health Hackers before where we've discussed the gut-brain connection, and this is more about the kind of gut-mouth connection. And I'm a big fan of fermented foods. I had one thing I was wondering the other day. I was drinking some kefir, it's a fermented goat's milk drink, the one I was drinking. And I was thinking, this is during the time I was reading your book. I was thinking, these little bugs in this kefir, this is probably really good for my gums. I'm going to swish it around a bit. And then I thought, but do the milk acids attack the teeth? So am I doing harm as well as good?
Well, there's actually studies, most of the studies, there's a smaller amount of looking at the oral microbiome, but they are based on milk-based species, so lactobacillus species that we find in fermented milk drinks. And what they do is they do release acids. So lactobacillus, they release lactic acid. what that acid does is it inhibits harmful bugs. So what probiotic species do in the mouth is that they actually stop the growth of the bugs that do cause disease. So the release of acid, we've kind of seen it as always harmful, but the overall pH of your mouth is a balance between trillions of bugs. And so we should see that what's happening in a fermented drink, for the most part is beneficial. You can go overboard and cause acid erosion by having too much, kombucha or too much acid profile in the mouth. But overall, we want those probiotic species and a diverse biological environment that protect us against disease-causing bacteria.
So you don't use supermarket toothpaste. Do you use like a natural non-fluoride one?
Yeah, I use, there's a couple that I use. There's one, there's a coconut-based one. Some of them use baking soda or activated charcoal every now and again. It's a little bit abrasive, but it's not bad for kind of absorbing certain things that cause a bit of tooth staining. But, the real thing about toothpaste is that, it really is like, taking a car with an engine problem to the car wash. You're dealing with a very small aspect of what's, you need to look under the bonnet if you've got an engine problem, not simply just, wash the paint job.
I haven't used fluoride in my toothpaste for a couple of years. I'm not against using fluoride. I just prefer my non-fluoride paste. And when I was at my dentist a couple of weeks ago, she was nice about my teeth. And I said, oh, well, that's good to hear, because I haven't used fluoride on my teeth for a long time, maybe a couple of years. And she was really shocked. She was like, not even in toothpaste? And I said, no, which really surprised her, because I guess she's been telling me for years at my dental practice to keep using fluoride. But my teeth have been okay for a couple of years using a toothpaste that sounds quite similar to yours. So is it a lie or I mean, not an intentional lie, but is it an untruth that we have to use fluoride to have good teeth in the long term?
Yeah, it's not true that we need fluoride to have good teeth, because for the most part of human history we didn't have fluoride, or for the most of humans didn't. But when you look biologically, what fluoride does, it acts on the tooth enamel. So it's incorporated into tooth enamel to increase its acid profile, its resistance to acid. And when you look at what the tooth actually has in place to protect itself against decay, you have an immune cells inside the tooth, and that if you feed your body the right thing, which are those fat soluble nutrients, because these are part of the osteoimmune cell, which is manage your bones and teeth, then your body has an automated immune reaction to the bacteria in your mouth. The other side of it is if you balance the oral microbiome, so if you have healthy bacteria, they also protect you. So you've got cells in your mouth that protect an immune reaction against tooth decay. You've got bacteria that should be protecting you. Fluoride is acting on a very small, window between that. There are clinical applications of fluoride. If we have rampant decay, we can put it topically, and that can help. But in terms of using as the paramount, approach to prevention, it doesn't make a lot of sense.
We are just about up on time, but this is so interesting. I've just got to ask you a couple more questions. From the book, there was something that really shocked me, the potential heart attack warning in our mouths that you talk about. Can you give us an outline about that? Yeah,
so most people know that when they go to the dentist, for your 6-monthly clean, they get the scaler out and they get behind that painful bit behind your front lower teeth. And most people know that you get that little bit of that plaque build up behind your teeth. It's called dental calculus, and that's calcified dental plaque. And what happens with calcified dental plaque is that you get a plaque build up on your teeth. Everyone does, but some people get a very thick calcified build up, and that's why you get it behind that front teeth. Is there's a salivary gland that spits out calcium rich saliva there. Now the issue there is that I see people that get very, very thick calcium calculus build up on their teeth, and the reason is not that they're not cleaning. They'll actually clean their teeth quite well and they'll have good oral hygiene, but they still get this build up, whereas someone that doesn't clean their teeth will not get the build up. And the difference is how their body uses calcium. And so the link goes back to that nutrient we talked about before, which is vitamin K2. And so what vitamin K2 does is it activates proteins that carry calcium in the body. And so if your body, if you have enough vitamin D and you have enough calcium in your diet, you will absorb calcium, but you won't be able to distribute it. You won't activate the K2 activated protein that carry it into bones and teeth, and it may calcify your plaque. But the other side of it is that a study in 2011 showed that women who actually take vitamin D supplements and calcium don't increase their bone density, but they increase their risk of heart attack. And the reason is that their cardiovascular system actually calcifies because they're getting these little bone spindles in their arteries. And so the coronary calcium score is now becoming one of the most accurate ways to measure cardiovascular risk. And it's the body's calcium management, which we can see on that buildup in your teeth. If you get calcium buildup in your teeth, we see it in people with kidney failure and dialysis, and that's because the body is not managing K2 and calcium. And so you should think of what happens in your around your gums is also happening in your arteries and vessels as well.
Wow, that is fascinating. If anybody listening is taking medication or calcium as medication, don't quit it. Just talk to your doctor about it. We're not giving out any medical advice, but that is really, really fascinating to hear. Can I ask you a couple of quick questions? Do you floss?
I do floss, yeah. So flossing I find is good for gingival health. There's a lot of plaque that gets built up between. I find it keeps gums healthy. I floss daily.
Is it true that we definitely have to floss every day, twice a day?
So the studies that in 2014 everyone asked this question. No one wants to floss. The dentists have been trying to get people to floss for years. The truth about flossing is that the studies aren't conclusive on the benefits. But from everything we've talked about today, Gemma, you see that there's more to the picture than just taking away that 30% of plaque that fits between the teeth. So flossing is a tool. I think it does have I've seen good anecdotal benefits in myself and in my patients. The American CDC don't recommend it anymore because there's no actual clinical. They took it off in 2014. You said because the evidence doesn't support it. But when you put it into perspective of what's happened, there's far more going on, and we've become a bit reductionist in saying flossing and tooth decay, and I really think we need to be a bit broader and instead of just looking at one factor. Which
if you have tooth decay, is it your body telling you that you are unhealthy and not eating enough fat soluble vitamins in your view?
I think it's a cardinal sign that that's happening, because almost by definition, it's a sign that your body is in it doesn't have enough of those nutrients to manage the hard tissues, which are your teeth. You have to remember that in biological systems, tooth decay is very, very rare. That's in animals, that's in the history of humans. And if you have a toothache as a hunter-gatherer, if you're out in the wild, there's no oral surgeons, there's no dentists out there, you're going to die because an abscess is fatal. And so you have biological systems there that are designed to stop that from happening. And so it's a certain message that something is out of kilter from really where it should be.
And finally, tongue posture. This is brilliant. This is a brilliant part of your book. Tell us about the importance of tongue posture in a couple of minutes, if you can.
Yeah, so tongue posture is really important, and the tongue's an amazing organ, and it takes up a huge part of the homunculus, which is the part of our brain that maps the sensory and motor part of our oral cavity, but also all over our body. And why the tongue is so representative there is that its posture controls so many muscles. It connects to the base of the skull, to the hyoid bone, which is a floating bone just here in the neck, and it holds open your oropharyngeal airway. And your posture is how that happens. If you don't have the tongue posture, which sits up to the roof of the mouth, then your tongue will be low, and actually we call it a low tongue posture. And it'll predispose you to mouth breathing. So the reason why tongue posture is important is that when the tongue is suctioned to the roof of the mouth, we see that you can't breathe through the mouth by definition. And so that's actually sealing the oral cavity. And it's actually engaging all the muscles in the neck here to hold the neck nice and straight, the airways open, and then you can breathe through your nose. So the tongue guides all of the tools you have to breathe and deliver oxygen.
What can you do about bad tongue posture? What do you do?
So a lot of people now have oral restrictions, so a tongue tie. So get checked for a tongue tie, even in adulthood. If you have neck pain, if you have issues with back pain, then it might be the forward head posture. But so you can retrain yourself to posture your tongue against the roof of the mouth. And one way is a swallowing pattern. So people have forward swallowing patterns, and that's where the tongue goes through the front teeth instead of up to the palate. And so it's basically like a gym program for your tongue, where it's called myofunctional therapy, where you train the tongue to sit at the roof of the palate and the lips closed. And so you're facilitating breathing, but also the correct posture. And in kids, if we get kids to put their tongue to the roof of the palate, their jaws will actually straighten naturally. So crooked teeth will, in certain stages, correct if we just correct their posture.
So at rest, our natural tongue posture should be, when our mouths are closed, it's touching the roof of the mouth and we're breathing through our nose.
Yeah, it's right to the back of the tongue, Gemma. So right to the where the hard palate meets the soft palate is really where the tongue should be suctioned up. And so what that does, and you should even feel it pressing out against the teeth as well. And what that does is send that expansion message to the because remember that really that our we need to keep sending that epigenetic message to our upper jawbone, because otherwise over our lifetime we might slightly lose a bit of width in our maxilla. So it matters over your life. And certainly if you're mouth breathing, you can see the patterns. You get certain wrinkles around the lips, and we see that posture has a visible effect.
Stephen, this has been really, really interesting. Thank you for running over time with us. Listeners, if you like this episode or you liked watching this video, I'd love you to subscribe to Health Hackers on iTunes, then you won't miss the next show. And while you're there, you might even leave a nice review of the podcast too, because those reviews really matter to me. Thank you. Thanks for listening, everyone. And Stephen, thank you so much for talking to us.
Thanks, Jim. It's such a pleasure. Thank you.